And welcome to the inaugural episode of Voices for Self-Care, where we advocate for moving national policies for self-care from policy to practice. My name is Oyare, and I'm so excited to embark on this journey with you. In short, Voices for Self-Care is the #1 show advocating for self-care in Nigeria. Now, the thing is, health is the most pressing priority for every individual, and this underscores the urgent need for self-care. Since 2020, White Ribbon Alliance have been in the forefront advocating for self-care policies and interventions. And that is why here on the Voices of Self-Care podcast, we will be moving and championing that these policies move from just mere policies to practice. Now, on this show, we are also going to be having one-on-one sit-downs with partners, policymakers, and other stakeholders to explore their efforts and to discuss ways to increase funding and access to self-care commodities for all, especially women across the nation. The Voices for Self-Care podcast also aims to dismantle misconceptions around self-care, to talk about what self-care is and what self-care is not. This show is going to be so insightful and exciting, so please, you do not have to miss it. And at this point, I'm going to ask you to please subscribe and turn on your post notifications so you get notified anytime we make a post. We're going on a short break right now, and when we come back, we have our very first official guest on the show. We'll be right back. Welcome back to the Voices for Self-Care podcast. I'm excited to welcome our first guest today, who will be officially opening the show with us. Our first guest is the Executive Director of White Ribbon Alliance Nigeria, Chief Tonte Ibraye. Welcome to the show, sir.
Thank you, Oyare.
Okay, so what is self-care? When we be talking about self-care behind the scenes, we'll be hearing what self-care is. So for people who are just hearing self-care for the first time, or for people who just care to know, what is self-care?
Thank you once again. Basically, self-care is the ability of individuals, families, or communities to maintain and manage their health and prevent diseases with or without the help of a healthcare provider.
Interesting. So why is it so important? Why are we talking about this at all? Why is self-care so important?
Self-care is important because, our population is very high, and that is a lot of burden on healthcare facilities across the country. And so if citizens have access to self-care, it will reduce the burden on our entire health system, so that health workers will be given the opportunity to focus on critical and emergency life-saving issues. Yeah.
Amazing. So let's talk about the status of self-care in Nigeria based on the national guidelines. Have you seen any solid proof of tangible implementations?
First of all, Nigeria is the first country to develop a national self-care guideline as a result of the sustained leadership of the Federal Ministry of Health, along with other critical partners such as Society for Family Health, Johnson International, White Ribbon Alliance, Pathfinder International, WHO, and so many other partners that have contributed significantly towards the development of a national self-care guideline to manage the entire use and access, to self-care in Nigeria. However, after the development of the guideline, there is need for states to adopt and domesticate the guideline. And so far, the guideline has been domesticated in a couple of states. Dissemination has taken place in, I think, about 25 states, including the Federal Capital Territory. We are still hoping that states will begin to use the content of the guidelines to develop their own implementation plan that is costed with budget allocation, so that women can continue to have access to self-care commodities to prevent diseases and illnesses and manage their health as well.
Okay, let's talk about challenges, right? What would you say the biggest challenges has been in moving from self-care policies to practical implementation within the Nigerian healthcare system?
Nigeria has a lot of fantastic policies. The issue has been, implementing those policies. That has been a very big issue, and a lot of national and global players have continued to emphasize that we need to ensure that policies are implemented and we practice those policies so that the health and well-being of women can improve in the country. So far, there is a self-care guideline and domestication has taken place, but a lot of states are finding it difficult to commit resources, especially to ensure that the commodity security basket fund has enough money to procure family planning and self-care commodities. And when there is stock out, women and girls who want to have access to these commodities will not. And it results into a lot of issues, and we have been advocating for that with the leadership of the Association for the Advancement of Family Planning and other critical stakeholders, including the White Ribbon Alliance. We are very happy that the government has, released for the first time in about 4 years. They've released about $4 million US, which is the annual commitment they have made for, FP and self-care commodities in the Family Planning 2030 commitment. And this has also unlocked additional $2 million from UNFPA. So it means there is about $6 million this year for procurement of commodities. The funds are still inadequate. We want them to, invest more because when citizens can manage their health, from their house, especially those who need access to family planning, of course, it will help to manage the number of unwanted pregnancy. It will also help people to space their children, childbirth spacing,
unplanned
so that people can have kids that they can cater for. So if you need family planning commodity, you just go to the health center and they give you some prescriptions. You get the commodities you need. You go home and then at your own convenience, you use them.
Okay, so in summary now, you're saying now that one of the biggest challenges for moving self-care policies to practice is funding, release of funding.
Funding is a very big challenge because without money, you can't do anything, right? Yeah. And when it comes to the health sector, we need government to commit resources. So far, a lot of the funding coming to family planning and self-care commodities has been from donors. And we are saying, no, that is not enough. Nigeria should commit significant amount of resources to the procurement of commodities, and then donors can assist. That's why the need for accountability is very important. The one you have, what are you doing with it? When we talk about it, then we can begin to talk about what donors are bringing, which of course is just like a drop of salt in an ocean. You get me? So we, like, I think 1% of the consolidated revenue fund is supposed to go to the health sector, and CSOs are coming together to ensure that there is accountability around the area. So the same thing for the family planning sector as well.
Okay, so let's talk about some of the reasons why these challenges are there. Would you say that there is a misconception around self-care that is posing as a significant challenge to why these policies are not being turned into practice? Would you say there are some misconceptions around why maybe funding is not being released, or around this concept of self-care generally?
Of course, just like anything, there will be misconceptions,
Okay.
right? But I don't think that is the reason why government is not committing resources, or enough resources. There are misconceptions like, some people feel, oh, if we don't have enough people coming to the health center to seek for advice and skilled health workers support, how will they keep their jobs? But the health centers are overburdened with a lot of people. Have you been to some health centers? Some people practically wait all day, and sometimes they'll just tell you the doctor is not available. Can you come tomorrow? And so it's exhausting because you have to go back home the following day. You have to spend money on transport fare and all that. So it's a lot. And so self-care does not mean that as a health worker, you're going to lose your job. No, we just want you to focus on the most critical issues. It will help make things easier. Yes,
Exactly.
we have a population of over 200 million. Imagine half of that population going to the health centers all the time, And then beyond that, there is the issue of water, sanitation, and hygiene. So when a lot of people are coming to the health centers, you have to spend a lot of money on maintenance costs. Now that we are talking about how hard the Nigerian economy is, this is the time for us to begin to invest in self-care and family planning to ensure that people have the number of children that they have the capacity to take care of. Another misconception is that self-care is self-medication.
Exactly.
I would say yes and no, because self-care can be practiced with or without the healthcare provider, but it requires medical advice, medical help from skilled workers, skilled health professionals. So most of us see self-medication as when you just go to a pharmacy to get
drugs over
the counter without the normal medical advice and all that. But self-care is beyond that. It is, with the help of a healthcare provider, and then, when you are at home, with that help and advice that you've gotten from them, you'll be able to manage your health to prevent diseases and illnesses.
Exactly. Amazing. Now, this brings me to my next question about the purpose of this show. Could you explain the primary goal in relation to promoting self-care interventions in Nigeria?
The White Ribbon Alliance is an organization that brings stakeholders across different sectors together to discuss the health of women and girls and to ensure that the right of women and girls to have quality health care is realized, especially when it's related to sexual, reproductive, maternal, and newborn and child health, across Nigeria. So we continue to amplify the voices of women and girls across the country, and the Voices for Self-Care, was created to provide a platform for us to begin to talk about, self-care across the country, be it carrying out advocacy for increased funding for self-care, and also ensuring that citizens are comfortable with self-care, and also to generate demand for self-care practices across the country. So we are hoping that with this platform, misconceptions about self-care will be clarified, and people, both communities, families, and health workers across the country will be very comfortable practicing self-care, so that the burden on the health sector will be reduced.
Amazing. So how does the Voices for Self-Care podcast, how does it evolve? Because I remember that White Ribbon Alliance started a What Women Want campaign in about 2021, right?
Absolutely.
So how does the Voices for Self-Care campaign evolve from that What Women Want campaign? And what we have learned, what can we learn from that initiative?
Our campaigns have also, they've always resulted in increased investment for the issues that not just we, but the issues that women and girls care about. And so some years ago, we started the What Women Want campaign, and we approached, I think, almost about 80,000 women across Nigeria to ask about what their priorities are when they want to seek quality, reproductive, maternal, newborn, and child healthcare services. And most of them talked about respectful care, water, sanitation, and hygiene in healthcare facilities, and also confidentiality and privacy when they visit a healthcare provider, access to family planning, including self-care, commodities, and all that. And as a result of that, we got a lot of commitment and investment from both government across different states and stakeholders in the health sector. There were states where there was increased investment in ensuring that there is adequate provision for water, sanitation, and hygiene. Toilets in healthcare facilities were renovated. And so after that, we also had the campaign to talk about what midwives want, especially to understand the needs of midwives in order to provide quality midwifery service for the benefit of women and their newborn. And as a result of that, we were able to amplify the voices of women, not just within Nigeria, but also globally.
Yeah.
So now we are focusing on self-care because it's the new area that people are beginning to look at, especially as populations begin to increase, as demand for quality healthcare increase. We want people to have access to not just information, but the right products and services, so that when they are at home, they will be able to utilize that information and use the products that have been provided for them, the commodities, to ensure that they maintain their health, they prevent diseases and illnesses. So it helps to achieve universal health coverage very faster.
What would you say, what strategies would you say that WRA, specific strategies would you say that WRA Nigeria is hoping to employ through this podcast to engage stakeholders so that they can transition, they can collaborate to transition from policy to practice, self-care policies to practice?
All right, thank you, Oyare. For White Ribbon Alliance, we are known as conveners, not just in Nigeria, but globally. And as part of our mandate to convene, the Voices for Self-Care will give stakeholders the opportunity to talk about, issues relating to access to self-care. And we are starting with, stakeholders at the national level, and then we also bring stakeholders at the state level as well. For example, we have been working with partners like the Federal Ministry of Health, officials from Society for Family Health. As you may know, the Federal Ministry of Health is leading the coordination effort on self-care implementation across the country. And there are different organizations and partners that are working on different issues. For example, Society for Family Health via the DISC project, is ensuring that women have access to DMPSI self-inject. And then there are other organizations like Johnson International, GSI. They are very good with data, supporting the ministry with dissemination and domestication of the self-care guidelines. White Ribbon Alliance is also providing support with amplifying voices, supporting the ministry with convening. And so we also bring some commissioners of health at the state level to talk about, healthcare financing, and basically all of this discussion is to provide a platform where people can transparently talk about how we are moving from policy to practice to ensure that women and girls benefit from this self-care intervention, and self-care is expanded across the country.
Okay, so I'm going to ask you two last questions. The first is, where do you hope to see self-care in Nigeria in the next few years?
I am looking forward to a country where all our health centers are not overburdened with a lot of people, both people with minor illnesses. Sometimes people have prolonged headache and they just want to see a doctor, but with the help and advice of a doctor and with the necessary information, they can just practice self-care in their respective homes. I mean, just for example, in the past, a lot of people used to go to the banks to queue up to get cash from the
counter,
hall, right? But then banks began to provide ATMs, and there were ATM machines, and now there are POS vendors everywhere, and so people don't necessarily need to go to the bank when you can use a POS vendor and all that. I was once in Switzerland. I attended an event, and I went to the bank to catch a check, and I saw that there was almost no one at the bank.
Yes.
So the same thing for self-care. We want health workers to focus on the critical issues, although it won't get to the extent where there will be no one at the hospital, because people will always get ill, unlike the banking sector. But they should focus on emergencies. And critical issues. People will continue to have need for access to emergency obstetric care. Women will continue to have such needs, and they will continue to go to the health centers. But those illnesses that they can manage from the comfort of their homes, they should be able to manage them when they have access to the necessary information and support and commodities that they need.
This is a very interesting conversation, because I love the part where you spoke about the misconceptions and how there has been some sort of opposition, especially from professional health groups or healthcare professionals. That is why the Voices for Self-Care is here. We are saying that self-care is here to prevent, protect, and empower you to take charge of your health. We want to move from policy to practice. We have a lot of policies already, and so we want to see these policies turn into practical implementation. And that's what I'm going to ask you right now. What would you say? How would you say that viewers, people who are watching this show, can contribute to the Voices for Self-Care campaign to amplify the message for self-care?
We want them to continue to take this message round, visit all our communications social media channels to not just listen and watch this show, but also to participate as well, and also whatever you can do within your own space, you should be able to support self-care. across the country, whether through your organization and whatever platform you have. And most importantly, we want government to continue to invest in self-care. We want more money for health, and we also want more health for the money.
Exactly.
Yes.
I love that. We want more money for health, and we want more health for the money. Thank you very much. And with that, we have come to the end of the first episode of Voices for Self-Care. If you have any questions, please send in your questions to the comment section down there, or send us a message at rancoms@gmail.com. My name is Ibraye, and I'll see you next time. Bye.